Hello, and welcome to the Texas Mind Exchange podcast. My name is Cody Gould, and I'll be your host. Today, we were joined by Dr. Clary. She is a professor here at Texas State University who works with us in the Translational Health Research Center. We talked with her about specifically her research on storytelling and well-being, substance abuse, and how she's looking into researching young adults and veterans. So without further ado, welcome to the Texas Mind Exchange. Just as a reminder, all statements expressed by our guests on this podcast are their own and should not be considered official views or opinions of myself or anyone else at Texas State University. Welcome.
Thank you.
I know that this, as we were talking about, podcasts are what makes a podcast anymore. Who knows? Is it video? Is it audio? We live in space and time and world, and we're having a good time. By the time this goes live, it'll probably be next year. But
okay, 2026.
2026, maybe.
Okay.
We could be jumping, we have no idea yet.
Okay.
But anyways, welcome, Kelly.
Thank you.
We are super excited to have you. I know that the Translational Health Research Center and yourself have done a lot of work together, which I would love to start with.
Yeah.
Before we start there, I want to hear a little bit about you, your background, your research. And to start off, I would love to hear about your research focus and how you got there.
Okay. So that's a long-winded question.
Great. We can take as long as you want.
Okay. So where do I start? I have an undergrad degree in social work, master's degree in social work. I have clinical practice, and then I have my PhD in social work. So all of my degrees are in social work. And, getting into social work, wanting to work with people along the lines of mental health and substance use addiction has always been something that really fascinated me. Being really passionate about mental health and how people behave and interact with others, take care of themselves, really started, I think, at a young age, just wanting to work alongside people, work with people. So going into social work really made sense in being able to do a lot of different things with people. So when I was in Illinois doing my degrees, I was also practicing. So I worked at an outpatient substance use facility where I was running groups with individuals who had substance use disorders. I also worked at a juvenile detention center. So I was able to see youth. I was able to see their cases and really, their challenges in mental health and substance use and maybe how that got them, incarcerated. And then I worked as a crisis social worker at an emergency department. So I would work alongside emergency doctors, nurses when a patient was suicidal or homicidal. I would do an assessment, and then we would determine the best approach intervention that they needed. And then I also worked at an inpatient psychiatric hospital doing assessments with individuals who were seeking mental health treatment, rehab, or medical detox from substance use. So hopefully from that, you can see a lot of clinical experience in mental health and substance use. And then I also, at the University of Illinois, as a graduate assistant, I was working in the Counseling Center's Alcohol and Other Drug Office, where I was doing first-year alcohol prevention programming for students. And we would reach students in psychoeducational courses their first year and share more about, policy and substance use to help them make, really informed decisions about substance use. So that, I share a lot about that clinical experience because that really informs the research that I'm doing right now in regards to understanding why people use substances and then looking at mental health and substance use disparities and how we can, do preventative work or do intervention work to help reduce those disparities. So one of the large grants that I have right now is doing education outreach regarding fentanyl for youth in Hays County. In addition to that, the mental health substance use piece, while doing my PhD, I realized that military members and veterans oftentimes have higher rates of mental health and substance use issues. So a lot of my work has also been supporting military members and veterans in regards to moral injury, looking at medical cannabis use, and then storytelling as a potential intervention for kind of their mental health or substance use problems. So I hope that answered your question.
Yeah, that definitely did.
Okay.
I feel like you've done so much. Is the main focus, would you say, substance abuse that you focus on?
Yeah, I would say like the root of it, where I'm most passionate about, is that substance use addiction. And I think the mental health piece comes in because we know a lot of individuals have co-occurring issues.
Yes.
And I think mental health issues could either potentially like initiate an addiction for like that maladaptive coping, or, you know, vice versa. When we think about somebody having an addiction, potentially mental health challenges might transpire from that.
I feel like addiction is such an important thing to research.
Yeah.
Obviously, its impacts on our communities, fentanyl being the big one that you mentioned earlier. Are there any things about addiction that maybe if community members are listening to us that they might not know, or that you would like to inform them about, like the research that's being done?
Yeah.
Like on that's coming across your desk that's new and interesting?
Yeah, that's a good question. So what comes to mind is I teach an alcohol and chemical dependency class on campus for students. And the first day of class, one of the first things that I share is that addiction affects everyone, whether that's directly or indirectly. It impacts us. It impacts everyone in some way. And I think that's important for society to understand that from like a public health perspective, because there is so much stigma and I think negative views about somebody who does have an addiction, that it is, you know, them being weak or they choose to do this. And I think if we can see this as, you know, a public health problem, it impacts society in many different ways, then we can be more like compassionate about addiction and about kind of that prevention work and education earlier on.
Is there, and this might be going too far over my skis, but I'm gonna ask the question anyway.
Yeah.
Is there a research that's done into compassion and addiction? I guess what I mean by that is I think that like what you're saying from a public health perspective, that link seems to be so important, because it seems to be people might place individual responsibility upon quote unquote mastering an addiction, compared to if there is societal compassion built up, we could have a better public health outlook on like how to really assist people that are going through this you know, tumultuous time. And I just wondered if there had been any research into that, or about how the public sees addiction at all.
Yeah, I think that's a really great question. What comes to mind is, you know, the harm reduction approach, the idea that, you know, people are going to use substances, people are going to, you know, engage in those high-risk behaviors, but how can we teach them to do it more safely so that other consequences don't transpire? So thinking about like Narcan being available, thinking about clean needles, like those types of things I think are compassionate. I've listened to a TED Talk that really comes to mind that I share in class about how harm reduction is a compassionate approach to assisting those who have a substance use problem, compared to the abstinence approach of like, don't do it, you're wrong if you do it, there's only either you do it or you don't do it.
In that way, you're kind of, if you have that approach, from what I hear, is like you're kind of,
I think being more understanding.
Yeah.
More understanding, more, you're not being judgmental, right? You're meeting the person where they're at. And you're meeting the person where they're at, which I think is important in social work, in that you are allowing them to decide and have that autonomy, but to make those decisions with like more education. So making those more informed decisions. So giving them that education to make hopefully better decisions. Yeah.
Yeah.
Does that make sense?
I think it does.
Okay.
I think it does. Where my brain immediately went to was like how this does impact the community on a rolling basis.
Yeah.
And all this information coming out is so important.
Yeah.
And sometimes there is congruency between the research and legislation and community outlook, and sometimes there isn't. And that's just something that we deal within a moving basis.
Yeah.
But I guess from to learn more about what you focus on, whether it be substance abuse or veterans or things along those lines, like what are some things from your findings that you might be excited to share that you learned over the past few years?
Yeah. So one piece that I'll talk about with our veterans is that we conducted a photo voice study with student veterans here on campus because we wanted to understand more about their well-being, and obviously mental health, physical health plays into that, right? When we think about overall well-being. So we asked our student veterans to take pictures of their positive well-being and then their negative well-being. And they would take pictures when they're in the classroom, when they're at home, maybe at the recreation center, when they're walking their dog. And then they would show us these pictures, and then they would talk about the pictures and how that relates to their mental health, how that relates to their physical health. And what we gathered from that qualitative study was that, photo taking, being able to share what those images truly mean to them can be very therapeutic in like an informal setting, right? They're not sitting down with a therapist and talking about their problems, but when they were talking about those images, some of those problems about stress being in the classroom or like transition or, their identities changing came up. And that was, we received positive feedback that was a really positive experience. So I share that because this storytelling opportunity, being able to reflect on creative expressions can be really, a holistic opportunity for engagement and supporting veterans. So that was one thing that we have shifted to in our research, which then trickled into, we now have a VA grant where we are collecting stories of veterans who have passed away and who are interred in a VA-funded cemetery in Texas. So we're interviewing family members and friends about their veteran to really preserve their legacy and honor, that veteran's story. So I think that was a really unique kind of transition, which really highlights unique and creative approaches to supporting different groups.
Through storytelling. Yeah, that seems so interesting because I feel my background's in interpersonal communication. That's what I have my master's degree in. I feel like we talk about storytelling a lot as a way to get a message across because people are interested in it. But to think about storytelling as an internal modality to understand what's going through your own, like going on in your own life and, either come to terms with it or work through that, it seems to be a really interesting proposal. Like before this idea, had you heard any research that had come out about people doing something similar to this, or is this a pretty novel thing?
Yeah, I think so. There's also another thing that comes to mind when you said that, but photo voice methodology is like a newer, innovative approach that qualitative researchers are using. It takes a lot of time and a lot of effort because there's a lot of moving pieces, but it is something that I think we'll see more of, hopefully moving forward, especially with like technology advancing. So I'm excited about that kind of, there being more studies with photo voice methodology so that we can collect different perspectives and different narratives of those who we are working alongside when we think about our research participants. But what you mentioned really made me think of like stigma and how these like unique creative outlets can help like destigmatize this mental health piece, right? Because it was like an innovative opportunity where we didn't go in thinking, oh, we're going to reduce stigma about talking about our problems. But really that kind of was something that transpired of like, how can we create other opportunities for veterans or other groups who might face stigma about their problems, mental health challenges, but give them this outlet that like, we're not saying you're going to talk about your problems, but it naturally comes up that they're talking about potential challenges.
And doing that in a way that seems maybe this is not the right word, but seems to be like a solo mission.
Mm-hmm.
It seems to be without the expertise of somebody from a social work background or a therapeutic background or something along those lines. It's like something that somebody's working through on their own, which is interesting because I guess when I think of stigma, a couple of things come to mind. When I think of stigma, I think of somebody not wanting to potentially admit or acknowledge that they might be going through a struggle, but also that they might not admit or acknowledge that they might need assistance. And when we think about like this storytelling aspect, do you think that could be potentially like step one of acknowledging like, ooh, maybe I'm going through something, and maybe I do, like, maybe seeking additional help could be something I'm going through, or is this this specifically to the kind of the photo storytelling? Is this a methodology that could be utilized to supplement some sort of potential like therapy or assistance from somebody else?
Yeah, so I could see it going both ways. I think like being able to potentially like acknowledge a problem or challenge by talking through a photo, but I think also really being mindful that I don't think this activity would, take over or supplement. I think it would be complementary.
Okay.
And we actually just had a holistic well-being roundtable with the Journal of Veteran Studies, which we talked about this in regards to like photo taking. We talked about beekeeping, and then we also talked about canine therapy, and like how these modalities should really be complementary rather than like supplementing a medical intervention or like a talk intervention.
Yeah. That's interesting, because I wonder where it's folded in of like autonomy and how autonomy folds into it or doesn't. I think that this is just like my own personal perspective, but I think that understanding one's relationship with going back to what the word you used, like with stigma, is so fascinating. And if this is an amazing tool to like open up the conversation around like, hey, what's really going on, or what's the reasoning behind this picture? I think you use the word psychoeducation, which I personally love. As I'm in school for counseling, I had even been exposed to like really fully understanding the background of psychoeducation, of like understanding what's happening in your own brain and being able to like bring that to good consciousness. But do you think that is one of the bigger underlying reasons why this seems to be working?
I don't really know. I think when we like name something like therapy or intervention, I think that like maybe like freaks people out sometimes. So if it's not like named something like that might help reduce the stigma, and people might be more open to engaging in that modality. So I think like language is so important when we think about working to destigmatize mental health and, help seeking.
Yeah.
And the psychoeducation, I definitely agree with like that being like so important. And some people like don't know what psychoeducation is or like how that works. So I appreciate you bringing that up.
Yeah, definitely. And would love to give you the floor if you want to talk more about that. But does that overlap with some more of the research that you do too?
Yeah. So I think the psychoeducation piece that I talked about earlier on. So I'll talk a little bit more about what I did when I was a graduate student. So at the University of Illinois, Urbana-Champaign, there was a unique kind of environment where policy or law was that bar entry age was either 18 or 19, but the legal drinking age was still 21.
Interesting.
Very interesting. And I think one thing, that comes to mind is like how we think about our approaches at the micro, meso, and macro level and how these intersect with each other. So because of that, there was a really big push on psychoeducation for first year and transfer students regarding alcohol, regarding policy, regarding, fake IDs, because that's a big thing. So I helped co-lead in-person psychoeducation for 9,000 freshmen and transfer students in the first 2 months of the school year, which was really great and a lot of work because we're meeting in person. And that is much different than, taking a course online to talk about or to learn about alcohol or to learn about, cannabis. So I learned a lot about how we can engage people about a topic that's really important. And like the information that we share, like they have to see a personal connection to it, right? In order for them to truly engage and really see the importance of it. So that was one thing that has really informed the work that I'm doing with my SAMHSA grant, where we are going into the classroom with 6th through 12th graders. We are teaching them about substance use. We're teaching them about fentanyl. We're teaching them about, overdose and how to call 911 for help. But for some of them, they might not see that connection of like, well, why should I care? That's not going to affect me. Or, they don't potentially see that connection. And as the program director, as a person who's creating these presentations and teaching our student presenters, we have to really engage them intentionally, right? We have to help them make that connection of why it's important. So when we go into like the 12th grade classroom, we went into the classroom in April in Wimberley, and one big push that I had was like, y'all are going to potentially be, in college in a few months, and, you might be at a party where you don't know somebody and they offer you something, right? Like making those very personal, real life examples, I think helps with that psychoeducation piece of why should I care? Why is this important to me? And how can I really take in that information and remember it when I need to remember it to make those informed decisions?
Mm-hmm. Or else somebody might not relate to the information and just kind of blow it off like you're saying.
Exactly.
Yeah.
Or just like, all right, I've heard about this before. Like, I'm just going to zone out for the next 45 minutes. So that really, as a leader and as somebody who is really passionate about doing that prevention work, doing that psychoeducation, really on the back end, I'm thinking about how we can help make those connections much more easily for the students at each developmental stage that they're in, right? Because how we approach a 6th grader about this information is going to be much different than how we approach it for 12th graders.
Yes. Yeah, absolutely.
And being developmentally appropriate is really important.
Yeah. You said something that I would love to go back to, which is prevention.
Yeah.
Is that a pretty big theme with most of your research that has to do with prevention, or is that a part of it? It seems to be prevention for me is so interesting because it's such an important piece of unlocking how to really help like the future of our society really at its core. But sometimes prevention can get lost, at least from my own personal perspective. Sometimes prevention can get lost because there's so much to deal with currently right now. Yeah. And so I'm wondering from your perspective, do you see kind of an even share between focus on prevention and current state, or am I missing the mark on that, you think?
No, I think that's really important. I mean, I think if we did a really solid job with prevention work, we wouldn't have to always worry about the intervention work, right? Developmentally, from like the work that I've done, a lot of my work has been with emerging adults. So 18 to 29-year-olds, which is like a really challenging developmental stage. And I can talk about that forever, but like the idea that like society thinks that like when you turn age 18, that like you're an adult, you're financially stable, like you can do all these things. But really, it takes years for you to really truly feel like an adult and feel stable in all of these different ways for most people is what research is telling us. So being able to do that prevention work, I think, is really important so we can help mitigate or reduce the likelihood that some of these severe problems will develop over time. Because research shows that, the younger somebody experiments with a substance or, drinks alcohol, the younger that happens, that increases the likelihood of them developing a substance use disorder later on in life. So I think prevention work, I see that as being so important. And if we can catch these youth as soon as possible to give them this information to make informed decisions, hopefully we can mitigate or reduce the likelihood of them needing, that severe intervention later on in life. But I think that going back to your point, like prevention work is very important, but intervention work is also really important. And I think, doing the work that I did in crisis and in an inpatient psych hospital, like being able to see some of that intervention work happening was really rewarding, but also very challenging and emotionally draining, because we know, especially in substance use, that individuals who go to rehab, like the likelihood that they are going to relapse potentially or need to go back to rehab, on average, I think it's like 6 or 7 times before they're sober, which can be challenging for mental health workers to kind of see that cycle. So yeah, I think, prevention work is really important. Intervention work is also equally important.
Yes. Yeah. You have such an amazing background with interacting with the community.
Yeah.
At least, from what you just said about actually, I guess pre-doc.
Yeah.
People say that?
Yeah.
Before going back to school.
Yeah.
You were doing a lot of inpatient work.
Yeah.
Now working with SAMHSA and other grants, bringing that information to the community. What do you what type of interactions have you had with with the community or with organizations locally that you might want to talk about that we might not know about?
Yeah. I will say, so having been in Illinois for, all of my schooling, I had a really great network of community partners and like understanding the university system really well. Moving to Texas during COVID, I started here in August 2020. It was very challenging for me because everything was really shut down, couldn't be in the community. And I'm somebody who's very kind of like an extrovert and like wanting to meet people and wanting to be in the community, wanting to understand the systems and how community partners work. So I would say I had a little bit of kind of a delay in doing that here. But community partners are so important to doing research with our participants. And that's one thing that I really emphasize in regards to my approach of research is we're working with our participants, not on them or for them. Really is this collaborative piece. And that can't be done unless I have community partners that trust me, that I can depend on, that they can depend on me. We have this, reciprocal working relationship. So for the VA grant, we work with Patriots Hall in Dripping Springs. We also work with the VFWs. We work with AMVETS. All of my grants have a community advisory board where we meet monthly. So our community partners tell us like what's happening, current events, challenges, and then they help us make decisions. So I really see it as a collaborative piece. And I don't think my work would be successful without my community partners. And then for SAMHSA, we are working with Wimberley ISD, Dripping Springs ISD, and then also Senecor, Texas Icon, Hays County Sheriff's Office, and Hill Country MHDD.
Oh, wow.
So there's a lot of moving pieces, and I think sometimes it can be challenging working with community partners because we're on different schedules. There's different expectations. So as a researcher, it really is my job to make things easy for my community partners. So like one small thing, I know that parking is terrible on campus, right? So I'm not going to make my community partners come to campus, right? We're going to go to like a public spot that has easy free parking, or else we're going to do something on Zoom. So like being very mindful of my community partners to make it easy for them to engage and for them not to feel like there's hurdles to doing work with me.
God, yeah. That parking is at Texas State a little bit difficult.
At every university, I feel like. Yeah,
totally. Which I guess is a good problem to have. That means that everything's full. So going back to that and the way that you're engaging with the community, obviously amazing. Like you have so many connections. It sounds like you're really beginning to make waves. What is the goal? Is the goal to disseminate a lot of the research? Is the goal to kind of fold in with some of those organizations? What would you say? Yeah,
I think there's like a lot of different goals. I think community partners being involved in research is important because there's a delay, as we know, with like academics publishing, right? And then the delay for those, findings getting out and then being translated, right? Like there could be years in that delay and then those findings actually being implemented, right? So I think if we're able to disseminate some of this information more quickly, like we can make more positive impacts, right? And we can reach more people. So that dissemination piece, I think, is really key. Also, being able to translate, which I think is, being part of THRC as a faculty fellow, like being able to translate the data, the findings, so that it is digestible and understandable for community partners, right? So making reports or presentations that community members can understand and they see why, community partners should work with, universities. So I think that is a big piece. I think also being able to support community partners in like additional grant funding, like applying for grants with them. I think, that continuity of funding, because we can't do our important work without money. So that is, I think, a driving factor. And then also like one of the big things that our community partners helps us with is like presentations and trainings. So they have a lot of expertise and experience and, social workers, therapists on their team, outreach specialists that can help and complement the work that we're already doing. So being able to learn from them learning from us, I think there's just like so many positives that come from working with community partners.
Mm-hmm. And I feel like that's one of the most important parts of doing research is to make sure that the information gets out.
Yeah.
And that's also one of the hardest parts about doing research is making sure that the information gets out. Simply because the integration between, I guess, a community partner and academia seems to ideally be there, but not always.
Yeah.
And that seems to be great that seems to be a really pivotal part of what you do and how you interact with the community is like making sure you incorporate those people who your research is potentially affecting into what you are learning, which seems to be amazing and impactful.
Yeah.
Or else you're kind of siloed, and those silos seem to be what could potentially withhold some really great, interventions or kind of findings that could potentially be out there.
Yeah, totally. And I think that silo piece is like so true that sometimes I think there is that like dichotomization between like Texas State and then like the community, right? And like how can we integrate? And, we know that our community partners are doing a lot of great things and they want to do more things. And like that is something that a lot of people at Texas State, researchers, faculty members can help supplement, and like vice versa of like what we're doing and how we want to disseminate that. So I think it's such a reciprocal, collaborative opportunity that I'm really hoping to continue beyond the grant periods that I have. And like we have conversations of, okay, we know this grant money is ending in, August of this year, but like we're not going to just stop. We're not just going to like pretend like y'all don't exist anymore, right? Like what can we continue doing so that when there is that next grant opportunity or there is this next issue that comes up, like you all can come back to us and we can continue collaborating or like pivot into a new direction.
Yeah, it's actually a perfect transition to the question that I had next, which was about challenges. And it seems to be obviously, when we think about grants and the way that grants work and how funding works, how something could be sunset while something else is going to be kind of on the horizon. When we think about making impact or disseminating research or conducting research, what are some of the biggest challenges that you think that you've interacted with?
That's a good question. I think I'll talk about clinically, and then I think I'll talk about like research challenges. I think clinically, especially in social work and like the clinical experience that I have had, especially because I think we all go into our specific discipline for certain reasons, right? I think there's some passion personal experience there of what drives us to be in that area. So for me, like being in mental health, being in substance use, I said at the beginning, like that's always fascinated me, but I've also had like family members, friends who have suffered mental health wise challenges, substance use. So that and experiencing and helping people can have emotional triggers, emotional baggage that we take home, right? So I think that is a challenge. Burnout is real when we think about clinical work, when we think about mental health, when we think about substance use. So I think that is a challenge. I remember like working like 12, 16-hour shifts at the psych hospital and just being like so drained that all I wanted to do was just like lay down and do nothing, right? So I think that is a challenge and it's something that needs to be talked about more. And like how important self-care is. And self-care can change over time. Self-care looks different when we're in school compared to when we're in the profession. But like that emotional baggage, that those triggers are real. So I think that is definitely a challenge. I think that also relates to research because I am working with the topic of substance use, right? I am working but just in a different lens, but I'm still hearing stories about somebody's uncle who passed away from a fentanyl overdose, right? I'm still hearing those stories. And I think now having, girls of my own and like, it just hits differently. So I think being very mindful of how the work that I'm doing could potentially trigger emotional responses. So still being very mindful of that. And I think that goes back to like what we talked about even before the podcast of like, at the end of the day, I am a human. I am not just a researcher. Like I have all these different identities and I have to like always take care of myself in order to continue doing this research with, these various groups regarding mental health and substance use. So I think that balance is really important as a researcher because we can get so siloed into doing the work that we're doing that sometimes our various other identities kind of get pushed to the side.
Yeah. Well, this is perfectly in the theme of something that we did talk about earlier that I would love to loop back in, which is humanizing the research. Yeah. And what you just said, like expressing some of those challenges that you have to deal with. Like, I think that's a really important part about telling people about what we're doing and what research looks like and how it's, not just looking at data sets all the time. It's actually about ingraining yourself in this work that can be really challenging, it sounds like. Yeah. And I would love to hear more from you about like kind of what breaking that wall or breaking down these silos and really humanizing the research might look like. Because I think that sometimes we might disassociate ourselves from research. Like research sometimes feels so far away, like such a distant thing. Yeah. But how do you think we can begin to humanize it a little bit more?
Yeah, that's a great question. And I think it goes back to also like in school, I feel like a lot of students are like, I don't want to go to the research class. I don't want to be a research assistant because I don't think a lot of people know like the depth and like the spectrum of what research can involve. Because I think a lot of people have this idea that research is just data sets, which of course that is so important in understanding those numbers and statistics and seeing trends. But also research is going into the community. It is doing work alongside partners. So I think being able to destigmatize research as a whole is really important so that more people feel inclined to try it out. I think also like humanizing research is like, I see my community partners and my participants at the end of the day, they're human, right? They are human. Their relationship to the agency is just one part of who they are, which helps me, I think, be more understanding and a better critical thinker when I think about how I'm going to approach the research that I'm doing and, how I'm going to work with my research students and my faculty to really like meet them where they're at, I think is what I'm trying to get at. The idea of like my community partners, if I view them as being human, then I can more easily understand their problems and meet them where they're at rather than me thinking, or viewing myself as the expert. They're actually the expert in their experiences and what they need as, an individual, as a group, or a community. So I think that humanizing helps see the bigger picture of how the research study that I'm doing is really just a part of their entire life, right?
Yeah. Well, to loop it back in, it's part of that story.
Yeah, exactly. Yeah.
And I think it's just such an important part of research that I think is not talked about all that often.
Yeah.
Because as I mentioned, as you mentioned, it's like it does feel so disassociated from the experience that somebody might be going through. When I think of research, I think of lab coats and somebody kind of like having a clipboard and writing down notes. When in reality, research can be exactly what you're saying of like, how can the researchers ingrain themselves in the community to observe what is going on, to see if things are working or not working, and then potentially use that information to influence future modalities or future findings or things along those lines. That's just so important. And that destigmatizing part is, I think, an amazing way of framing it. Because it's not just doing research in a laboratory. They're like, if that research stays in a laboratory, then is anything really being done from it? And what you seem to, from what I've gathered from this conversation, what you seem to do is like actually use the community, not just use it, but give to the community to make sure that research translates to impact.
Yeah, absolutely. And I think, meeting with my community partners, like, as much as I can, like meeting with them in person and like getting to know them as people, as human, helps build that relationship so that they can trust me in the sense of like, I'm not just proposing this grant so that I can get a course buyout or so I can get paid. I'm really doing this because I truly care about the needs and I want to help you all. So the SAMHSA grant, which I keep going back to, Tucker's Law was implemented in Texas in June of 2023, which requires all public school students, 6th through 12th graders, to receive education on fentanyl, substance use, mental health, and suicide. So our grant proposed to support school districts in fulfilling this mandate. So again, really the approach is we are here to support them in what they need, which I think just, again, emphasizes my approach with research is like research alongside. We're going to do this with you all so that you all can fulfill this mandate. You all can help your students. You all can help your students, make those informed decisions once they graduate or when they have the opportunity at a party.
To be prepared.
Yeah.
Yeah. And I didn't know that about Tucker's Law. And thank you for sharing because I feel that's such an important thing. I drive on 35 pretty much every day and I do see the billboards and I didn't know what that was in correlation to, but I didn't know that you were involved in that. It's amazing.
Yeah. And I think that goes back to like the micro, meso, macro implications and how they intersect with each other. Yeah.
And that leads me to ask I guess when I think about all the amazing grant work you've been doing, all the amazing research you've been doing, being awarded some of these very high level, large budget things, you must be really excited and proud of some of those things, which is amazing. And I would love to ask more about some of those things, but like I asked about challenges earlier. Yeah. The other side of like things that you might be really excited about or proud of. I would love to hear from that end of the spectrum.
Yeah. So I think the SAMHSA grant, which almost $1.9 million for 5 years. Wow. One thing that I always go back to in like all of our presentations and like all of the meetings that I have is how grateful and thankful I am for my team. While I am the project director and I am the leader technically, the work that we're doing wouldn't be possible without my team, without my students, without my community partners. So that's just one thing that I think as a leader, like acknowledging all of my graduate research assistants, all of my students, all of my faculty members who are working with me in order to implement the work that we're doing. So we reached 1,300 students in person in April and May, and we had a team of about 16 or 17 presenters that we trained up. A lot of moving pieces, a lot of logistics, but I'm really proud of all the time and effort that those team members put into it because they also had passion about this project and they also really saw the the importance and the value in going into the classroom. So I would say that was definitely a really great accomplishment this past year that I've been able to spearhead with the SAMHSA grant.
Yeah. I mean, that's pure impact right there.
Yeah.
That's really, really great. Really cool. I know we're kind of whittling down on time and keeping a time check. One of the most interesting things I would like to ask you.
Yeah.
I'm really bearing the lead on this one.
Okay.
Is your perspective about the future of mental health research?
Yeah.
I know that you seem to be the focus seems to be substance abuse, veterans, young adults. Where would you like to kind of push your research in regards to like where you think the future might be for you? What things would you might want to look into?
Yeah. So I've really enjoyed working with the middle school and high school students. So we're only in Hays County right now, and I would really like to expand to other counties throughout Texas. I think this piece on fentanyl is a current substance, but I think there's going to be new substances that come up that are just going to be, unfortunately, as fatal, if not more deadly. So I think staying on those current trends is going to be really important. One thing that has come up in conversations with students is the vaping, which I think we're now seeing more research about the effects of that, right? The physical effects of that. But I think there's also some mental health effects of that in regards to addiction and other potential co-occurring disorders. So I think staying on those trends is going to be really important when we think about education. I would also like to see education for college students around the topic of fentanyl, because there isn't a lot of it, to my knowledge. So being able to get into that emerging adulthood age range when we think about this topic and this psychoeducation preventative work is something that I see. And then in regards to my veteran work, we're really hoping to explore more about moral injury with veterans. And we have a proposal that we're going to resubmit in September that we're really excited and hope that we get funded. And really looking at moral injury, because it's not in the DSM right now. So looking at how that impacts veterans as well as veteran caregivers, and how they can tell us what type of interventions or what type of approaches might be useful for veterans and military members as we move forward.
Yeah, I'm not familiar with moral injury.
Yeah.
Before we end, could we talk about that a little bit?
Yeah. So moral injury, you put me on the spot in regards to defining it. But really the idea of like having these various feelings, guilt, remorse, potentially, of, being required to engage in certain actions or behaviors that maybe go against their moral compass, based on policy, leadership, and being able to kind of navigate some of those consequences that come from engaging in those behaviors or actions. Yeah, that's
fascinating. Thank you for, I didn't mean to put you on the spot, but that was a great definition. Immediately, I'm like, oh, I know exactly what you're talking about. That there isn't that much research into that. Then.
Yeah, and that was something that was defined, I want to say, back in like the 80s.
Okay.
And I think a lot of people, especially in like the military veteran research arena, or, the clinical route, may unfortunately diagnose something that is moral injury, maybe with PTSD or something along those lines. So we're seeing potential misdiagnoses. And when veterans, military members learn more about moral injury, then it's like, oh, actually, I think that is what I'm experiencing, rather than maybe this other diagnosis that was given to me.
Yeah. Wow. Well, I hope that you win this grant and do some research into this, because it sounds very fascinating.
Yeah, thank you.
Well, what's the easiest way for people to reach out to you?
Yeah.
In contact.
My email, kellyclary@texasstate.edu. I'm always open to networking and collaborating, and thinking about other grant proposals, projects, getting students involved, community partners. I'm always open to conversations.
Amazing.
Yeah.
Well, Kelly, thank you so much.
Yeah.
And yeah, that's the end. Thanks for joining us.
Cool.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.